Ma'am, we are live on Facebook. So with your permission, Shivani madam, should we start?
Yes, we can start. Shall and introduce Shivani first.
Yes.
Yeah.
Good afternoon, doctors. I am Dr. Vishal Vahane and working as a senior medical advisor at Walter Bushner. On the behalf of the company, I take this opportunity to welcome all the faculty members, guest of honors, speaker, chairperson, moderator, panelists, and all panelists for their valuable time for an important webinar on vaccines birth to old age. It is my privilege and honor to introduce first Dr. Shivani Sabharwal, madam. She is an obstetrician, gynecologist, endoscopic and laparoscopic surgeon at Jeevanmala Hospital and Apollo Spectra Hospital. She has been actively involved in training of young surgeons and gynecologists who want to practice minimal access surgery through training program approved by IAG Foxy at Jeevanmala Hospital. She is current secretary of Delhi Forum Central, and she is also the treasurer of IAG Delhi chapter. She is also being involved as a faculty member, as a speaker at various national and international conferences. So now I request Dr. Shivani madam to please start with the session.
Thank you so much, Dr. Vishal, for such kind words. Am I audible?
Yes.
Yes, ma'am, you are audible.
A very good afternoon to everyone. Delhi Gynae Forum Central welcomes you all to yet another important and a very pertinent topic for every clinician, vaccines from childhood to old age. Before we start the webinar, I would like to welcome our guest of honor, Dr. Sharda Jain. Madam doesn't need any introduction. She is a founder secretary of Delhi Gynae Forum. She's a great teacher, academician, surgeon, and a mentor for many, including me. She has been conferred with many awards, Lifetime Achievement Award from Foxy, IMA, Lady Harding Medical College, Delhi Gynecologist Forum, and ISAR. May I please request Dr. Sharda ma'am to say a few words before we start our program. Thank you, ma'am. Dr. Sharda ma'am.
I think madam has not logged in.
There is some network issue with Sharda ma'am's network, so she will be joining soon.
So Abhinav, can you do me a favor? Can you just talk to her, or Sayam can talk to her?
Ma'am coordinated. Ma'am coordinated. Okay. She will be joining soon.
Let's wait for Dr. Sharda ma'am.
Absolutely.
We need to start with her blessings, and let's just wait for a minute. She'll be here.
मैम उनके एरिया में नेटवर्क नहीं है, मैं दोबारा चेक कर रहा हूँ, तो we can either complete the
no problem. Till then, I would like to introduce and welcome our president, our current president, Delhi Gynae Forum Central. She's yet another personality who doesn't need an introduction. She's a Padam Shri. She's a founder, president of IAG Delhi chapter, present president of Delhi Central Gynae Forum, and past president of DGES. She's been conferred with many awards. She has done a lot of publication and done a lot of presentation in many national and international forums. I have another level of respect for her, not only professionally but personally, but it's my honor to introduce her today. And may I please request Dr. Malvika Sabharwal to say a few words before we start this webinar.
Well, thank you so much, Shivani. I wish you'd added the other bit also, the other side of our picture, the relation. I'm so proud to be the mother-in-law of Shivani Sabharwal. I always say mother-in-law because she's my very, very precious daughter. Thank you, Shivani, for lovely words. Let me tell you, let me just share with you, this is a very important forum. And I think as more and more people join in, we should have subject which is something of importance to all of us. Like Shivani mentioned, it's a very pertinent topic. We were thinking of the webinar, and as we were putting in our mind, Harsha came up. Harsha, just look up. She came up with the idea of vaccine. I said, that is what we want. Because vaccines are very close to us. They're so important. They are the ones which actually develop, they are the ones which give us protection. And it is important because this protect us from diseases. They can avert deaths. Almost like WHO says, almost 2 to 3 million deaths can be averted if you are vaccinated properly. And it is so important that it is it's given to all. So it is important to be up to date in this particular topic. We should, as health workers, not only know what is the latest, we should be able to provide it to the people, and thereafter making sure that they all get it. There are very simple ways without any much lifestyle change. They can all get it. It's a very simple way of providing to people if once we have made up our mind that we should do. And let me just share with you one very important fact. The year was 2008, and Mr. Richard Clark had come from the US. And they were just talking about Gardasil vaccine. This is MSD company. The country head from USA had come, and he visited Jeevanmala Hospital. And it was the only hospital he visited. We had a discussion. Next, I met him in the evening for dinner in in a WHO kind of a meeting. And soon it was there in the program, which was seen in so many countries. I think we'll be covering that. Pratima and Rekha are going to be covering all that. So I will not go on and on about it. But this vaccine program is something we thought should be seen by all as much, and also imbibed by us all to be able to give it to our patients. Thank you very much, Shivani.
Is Shada ma'am online?
Not yet. She will be. I'm in touch with her.
Okay. As Dr. Malvika has nicely explained, we all know immunization is a global health and development success story, saving millions of lives each year. It has shown eradication and near eradication of many diseases, as we know: smallpox, polio, TT, and there are many more diseases. Vaccines of more than 20 life-threatening diseases are available, which a person can use to make her life more healthier and longer for all age. It is a key component of all PHC and an indisputable human right. Yet, despite tremendous effort, too many people in the world do not have access to the vaccine. Either it is non-availability, cost, or lack of awareness. We doctors are the primary contact for these patients, and it's a duty to guide them correctly. Today, without further ado, we have stalwarts in this field who are going to guide us not only about childhood vaccination, but vaccination for all ages, and tell us about the basic and routine clinical scenarios which we all face. So I'm going to welcome our chairperson for the first session, Dr. Harsha Khullar. She's a senior consultant in Sir Gangaram Hospital. She's been a past president of ISOPARV, past chairperson of ISOPARV, ex-member of FOXI Breast Committee, and past vice president of Narchi Delhi branch. Ma'am, it's a pleasure to have you here. I also welcome Dr. Poonam Khera. She's an associate director, senior consultant in BLK Hospital, and she is awarded as an inspiring gynecologist of North India 2018 by Times Group. She has published many papers in her name, and her main interest is gynecological laparoscopic surgery in high-risk obstetrics. I hand over the mic to Dr. Harsha, ma'am. Harsha, ma'am. Dr. Harsha, ma'am, is going to introduce our speaker.
So, on behalf of Delhi Gynecological Forum Central, I welcome you all on this webinar on a very, very important topic, that is that vaccination or immunization from birth to old age. So as we know that the first 1,000 days in a child's life, that is very important, because most of the vaccinations they are given during this age. And then of course they come in contact with the pediatrician also. Of course, the first person a child comes in contact is the obstetrician, and later on it's the pediatrician. So the pediatricians, they are very, they've got very good relation with the child, because whenever a child goes to a pediatrician, he knows that he's going to vaccinate me. So we've got this very talented pediatrician who is in Sir Gangaram Hospital, senior consultant in pediatrics, Dr. Dinesh Kaul, and he's working as a consultant pediatrics, infectious diseases and immunology for more than 22 years. He worked as a clinical investigator in vaccine-related clinical trials. So I thought that he'll be the best person to tell us that what immunization or vaccinations are given to our children. And then later on, when a girl that is after the age of 18 years is comes in contact with an obstetrician or a female gynecologist, then of course what vaccinations are required, and that will be discussed by the obstetricians later on. So Dr. Dinesh, please, so you're going to tell us about the vaccination in children. Dr.
Sure,
Dinesh.
ma'am. Thanks a lot. Thank you. I'll share my screen. Let me see if I can. Give me a minute first. I'm thankful to the organizers, the Delhi Gynae Forum, who have made it possible for this meeting to be held online. Till I'll try to open the presentation.
I would request you to please first open the PPT in the background, and then you share the PPT directly. We can see your desktop basically, actually.
Okay.
Please stop the share first. Yeah. Once you go to share screen, directly double click on the PPT.
Just give me a minute. Sorry. I think it's here. It'll take some time to, because this is I need the.
Sir, have you opened the PPT in the background?
Yeah, I'm done. Almost. Just give me a minute. It will be. Yeah. Can you see the screen?
No, sir.
Okay, you can't see the slide?
No, sir.
Hold on, I'll share it again. Can you see the screen?
No, sir. Sir, you open the PPT in the background, and
yeah,
then
that's already open.
And then you go to share screen and directly click on the PPT and share.
Hold on. The presentation is already open. Screen share. Presentation. Okay, can you see the presentation?
We can see now. You just
okay, fine. Okay, fine.
Screen, sir.
Sure. Okay, so I'm sorry for the what we'll be discussing about primarily about the childhood vaccines, which are given right from the birth to 18 years of age. Primarily, these will be the recommendations from the American Academy of Pediatrics, from the Indian Academy of Pediatrics, from WHO. I was given to understand that we should have some consensus guidelines from the FOGC and other obstetric groups. Obviously, they are pertinent to the HPV vaccines and other vaccines. We'll be discussing maybe them in the panel discussion. Let's have a look at this statistics. Every year in India, about 26 million children are born. And we have about, this is about 13% of the population that is being, every year we're adding about 26 million children and they need to be vaccinated. And at the same time, we're having about 127,000 deaths every year per year because of under 5 children. Under 5 mortality is quite high, though over the years it has drastically come down. So 2019, our under 5 mortality was about 34 and our infant mortality was 28 per 1,000 live births. So these are very important deaths which are vaccine preventable deaths. So if we have appropriate vaccines, be it DPT, be it BCG, polio, so we can drastically reduce the under 5 deaths and the infant mortality rate. Let's have a look at this is the universal immunization program which is being followed by the government of India, and this is in fact given to all the children. These vaccines are given. I will not go through the details of all the vaccines, but these are more or less mandatory vaccines which are needed for children right from the birth till they to the school going about 5 years of age. So it's BCG, we have the pentavalent, we have the OPV, we have the rotavirus, and a lot of other things. And in addition to OPV, 3 doses they are given. Children are given fractional doses of IPV. Okay, so because the community, we don't have enough of injectable polio, so that's why they are giving 2 doses of fractional IPV to give some immunity against 3 types of polio viruses. But this schedule is a little different from what the Indian Academy of Pediatrics, what different pediatricians who are in practice follow. So they follow a protocol which is more or less endorsed by the CDC, by the WHO, and these involve a lot of vaccines, the BCG, the OPV given at birth. So no newborn leaves the hospital without getting an OPV and a birth dose of hepatitis B. And in most of the government hospitals and other hospitals, they give BCG, though there is a little institutional variability. Then the vaccines start from 6 to 14 weeks. Fortunately, we have pentavalent vaccines which are available. So you give them in a combination, plus you give rotavirus vaccines. Then at 6 months, then at 9 and at 12 months of age. Flu vaccine is given annually every year till 5 years of age. This is the recommendation from the Indian Academy of Pediatrics. Now, what is our concern is that as the children grow, the mothers, the parents, the guardians tend to forget the vaccination. So as pediatricians, as gynecologists, it's our duty that we at least reinforce the message to them they are to be vaccinated. By 5 years, everything is okay. Most of the children do get, but they miss their vaccines at 10 years. So it is very important that a 10-year-old child should get a adolescent DPT, Tdap, or even a TD vaccine. Plus, girls should be getting, this is an giving an HPV vaccine. I know that there will be a lot of discussion on the HPV in the later in the panel discussion. So this is the recommendation of the Indian Academy of Pediatrics. In addition to the routine vaccines, which I have, there are certain vaccines giving to the high-risk group. So these are high-risk children or in fact high-risk adults who should get particular vaccines like an influenza vaccine, which is given to the high-risk group, and some other vaccines like the meningococcal vaccine. Rabies vaccine is given for dog bite. So even pregnant ladies can get rabies vaccine and the immunoglobulin. These days we have shortage of immunoglobulin, so we are using primarily the rabies monoclonal antibodies. So this is a rabies shield which it comes, so it suffices for us for the need of an immunoglobulin. So as far as the pregnant ladies are concerned and the teenagers are concerned, after 10 years, we give them Boostrix or Adacel. So this is primarily an adolescent DPT vaccine where the antigenic components of both DPT and acellular pertussis are less as compared to the pediatric vaccines, but the tetanus components are more or less same as compared to the, say, it's about 40 international units. They are same in the, but the pertussis component, well as the diphtheria component is less because they cause allergic reactions, fever. So that's why the antigenic components of DPT, pertussis and diphtheria have been reduced. So these two vaccines should be given to adolescents who are more than 10 years of age as a component of a DPT vaccine. So as I said that this is the childhood schedule which we follow in the pediatric age group, and then at 10 years they should be given. If you don't have an excess or if they can't afford Boostrix or DTAP, they should be given TD or tetanus toxoid, which is given in most of the government health centers as a part of a for the pregnant ladies. So, but the recommendation is, because we were getting a lot of newborn cases of pertussis, because pertussis vaccine, we give it normally at around 6 weeks or 8 weeks of age. So that is the window. In those 6 weeks, these children are susceptible to get pertussis infection. So if we immunize the mothers with the pertussis vaccine during pregnancy, they should get at least 1 dose of Boostrix in pregnancy. So that will take care of the immune status for their infants, and the infants will be protected. So the message is that the Tdap should be given during pregnancy, and it can be given also post-pregnancy. So if that is not available, well, we can very well use TT or even tetanus toxoid will work. In addition to that, so if you have small children and there are certain household contacts, the grandmother, the maternal grandmother, the paternal grandmother, or aunts who are in contact with this small infant should be given ILD Boostrix, because they are the possible contacts which may transmit the infection to the babies. One more important pediatric vaccine and the vaccination for healthcare workers as well as pregnant ladies is hepatitis B. So they should be immunized with hepatitis B. As far as the pediatric population is concerned, we give them 3 or 4 doses of hepatitis B at different intervals. So in the national immunization schedule, we are giving 4 doses, but earlier we were giving 3 doses of hepatitis B. But mind it, whether you use 3 doses or 4 doses, all are quite protective. And as far as the preterms are concerned, a lot of preterms who are born at, say, less than 1.5 kgs, they technically get 4 doses of hepatitis B. We don't consider their birth dose of hepatitis B vaccine. So that's the recommendation for giving their 4th dose of hepatitis B around at 9 months of age. So these are the recommendations for giving hepatitis B vaccine to the preterm population. These are the American Academy of Pediatrics. They are more or less same as other children, giving them 3 doses of hepatitis B vaccine. So as for coming to the polio, so polio is a very important pediatric vaccine. Earlier, about 5 years back, we were giving all children OPV, about 5 doses of OPV. But since now we have eradicated polio, so our effort is to prevent vaccine-induced paralysis because of OPV. So that's why the emphasis is on giving IPV. So most of the children in the government sector get 2 doses of IPV, fractional IPV, and in the in the private practice, most of the children as a combination vaccines get 3 doses of IPV in first year of life, and then subsequently at 15 to 18 months, they get 1 more dose of IPV. So in the government setup, because of their cost constraints and the availability of the vaccines, they give 2 doses, that 2 fractional doses, they are given by subcutaneous route. So IPV 2 or 3 doses should be given. If we give them 3 doses, this is the interval. If we give them 2 doses, then 2 and 6 months interval is enough. And then 1 more booster should be given at 15 to 18 months of age. So these are the pioneers of the polio vaccine who have developed the polio vaccine. The credit goes to John Enders and his 2 fellows who got the Nobel Prize in 1954 for discovering the polio viruses in the cell cultures. They could grow the viruses, and then subsequently a vaccine was developed by other people. Coming to one more vaccine, which is very important in the pediatric age group and the pre-pregnant ladies who are planning to have pregnancy, not in the pregnant population, is the MMR vaccine. So MMR vaccine is routinely given at 9 months of age instead of the measles vaccine, which was given earlier. 1 more dose is given at 15 months. And in the Indian Academy of Pediatrics endorses giving 1 more dose of MMR third at 4 to 6 years. But 2 doses are more or less enough. This is not the schedule which is followed by most of the countries. The US follows a different schedule. So if you give even 2 doses of MMR vaccine, they are quite good enough to give immunity to the children as well as to the teenagers. So the recommendation ideally in the USA, in the UK, is giving first dose at 12 to 15 months and then 1 more dose at 4 to 6 years of age. So they will give good immunity. About 97% of the children will be immune with 1 dose. Then subsequently who are left over will get protection with the 2nd dose. One more important vaccine in the children is varicella vaccine. So we start giving varicella vaccine right from 1 year of age, rather at 15 months of age. And the efficacy, this is the Western data showing an efficacy of about 96%, but that's not true for 1 dose. It's to the tune of 75% is the efficacy, because children do get varicella infection even getting 1 dose of varicella vaccine. That's why the recommendation these days is to give 2 doses of varicella vaccine. So even if you were to vaccinate a lady who has not enough of varicella antibodies, you need to give them 2 doses at 8 weeks interval. So pre-pregnancy, this should be avoided during pregnancy. But inadvertently, if they receive varicella vaccine during pregnancy, they need not go for a termination of pregnancy. This is relatively safe vaccine. So all adolescent and adults without any evidence of immunity to the varicella should be given the varicella vaccine. And these are the high-risk individuals, like all healthcare workers, all doctors, because they should check their serostatus of varicella. If they don't have enough antibodies, they can get the varicella vaccine. And the pregnant ladies who deliver, after their delivery, if they don't have enough of varicella antibodies, they should be ideally given a varicella vaccine. So these are the recommendations of the Indian Academy of Pediatrics, giving 2 doses of varicella vaccine at 15 months and then later at 4 to 6 years of age. So these days we have a combination of MMR and varicella vaccine, which is given to the pediatric population. So there are 1 or 2 companies which make these combinations. So this vaccine can be also given to adolescent girls and to women who need both MMR and varicella, who are not having a good immune response with the rubella infection, because we are finding a lot of ladies who are being tested in the pregnancy for the rubella IgG antibodies. They don't have enough of rubella antibodies. then subsequently after their delivery, they can either get an MMR vaccine or they can get a varicella vaccine or a combination, whatever the need be. So these are the recommendations of the Red Book. This is the American Academy of Pediatric Guidelines. This is what we follow for the combination for varicella and MMR. Children are also given typhoid vaccine. So we start giving them typhoid vaccine as early as 9 to 12 months of age. So this is a typhoid conjugate vaccine which we give, and then later on we give them a booster of the same vaccine or the polysaccharide vaccine at 2 years of age. So women or girls who are more than 2 years of age should get ideally a VI polysaccharide vaccine if they are living in a typhoid endemic area. So that should be to prevent from getting the typhoid, because typhoid can lead to a lot of complications in the pregnancy. But this is not the recommendations that you should be giving it to every pre-pregnant population. So these are the type. There are a lot of issues with the typhoid vaccine, but I will not go regarding the issues. But it is quite safe vaccine which is used in the pediatric population, and we do recommend to the pediatric population. Hepatitis A vaccine is also a very important vaccine which is given after 1 year of life, and this can be given to the pregnant population. This is a kill vaccine. This one, the inactivated vaccine, who don't have enough of antibodies in their blood against the hepatitis A. The live attenuated vaccine is given to children as well as to other women, but this cannot be given during pregnancy because this is a live attenuated vaccine. This is a Chinese company makes it, but this has been tested and approved by the Indian Academy of Pediatrics. WHO has also in fact endorsed this vaccine, so we can use it, but not in the pregnant population. Influenza vaccine is a very important vaccine which is given in the pediatric population. Less than 5 years, everybody should get an influenza vaccine right from 6 months of age, and all high-risk people who fall in this category, including pregnant ladies, should be getting an influenza vaccine. And all healthcare workers, as healthcare individuals, all of us, the new season of the influenza vaccine, the northern hemisphere is already in the market. So I would advise the healthcare individuals should get the influenza vaccine. Pneumococcal vaccine is primarily a pediatric vaccine which is given from 6 weeks of age to 5 years of age. So this is not the vaccine which is given to the pregnant population, but it can be given to all healthcare workers or anybody who is more than 50 years of age. So they can get one single dose of pneumococcal conjugate vaccine, and it can be topped up, followed up with a conventional polysaccharide vaccine. But because as the age advances, so elderly population who are more than 65 years or 60 years, they are more vulnerable to get pneumococcal disease, the invasive pneumococcal disease. So that's why the recommendation is to give all adults who are more than 50 years of age, they should get the vaccine, the pneumococcal conjugate vaccine. There are two types of pneumococcal conjugate vaccine, the 10-valent and the 13-valent. They have different serotypes, which both of them, these vaccines can be used. Earlier, there was the 7-valent pneumococcal vaccine. We are not using this vaccine. We are using only this and this, the 10-valent or the 13-valent. In addition to that, we have a conventional pneumococcal polysaccharide vaccine, which is given after 2 years of age. It is also can be used, but it is not as immunogenic as the conjugate vaccine. These are the efficacy of different vaccines. I will just go through the human papilloma virus in a nutshell, because I am really sure that this is going to be a part of a heated discussion in the panel discussion. These are the IAP recommendations for the human papilloma virus vaccine. You start as early as 10 to 12 years of age. Only the girls in the Indian population is given. In the UK, USA, it is given to boys also. So you can start as early as 9 years of age. So 9 to 14 years, the pre-adolescent and or the adolescent girls can get 2 doses. This is a WHO endorsed recommendation. But girls who are more than 15 years or immunocompromised patients should get 3 doses of the vaccines at 0, 2 months, and 6 months interval. So this is the recommendation what we should be following. I can see Dr. Neerja Bhatla was there. She has a lot of say on the Gardasil. I think she can elucidate on the human papilloma virus. Then there is a newer, the nonavalent vaccines. These, the bivalent and the quadrivalent vaccines are available in the Indian setup, but in USA, you have a 9-valent vaccine because it gives more additional protection against 5 more serotypes. So which are cancer-producing serotypes. So whether you want to use the bivalent or you want to use the quadrivalent type of a human papilloma vaccine, so the decision is yours. Each of them have their own benefits and their drawbacks. So this is the newer 9-valent vaccine, but this is not approved. So our choice is to use a bivalent or a quadrivalent vaccines. So these are innocuous vaccines. These are derived from the certain set of viral proteins. So they are not infectious vaccines, and they are more or less not live attenuated. So they can be given in the immunocompromised population as well. I think I'll stop. Then we can take some questions in the panel discussion.
Sir, you can stop sharing your slide.
Okay, I'll stop the sharing. Okay, thank you.
Sir, is it possible that we take the questions at the end of the panel also? Because Dr. Neerja has to have another meeting at 4 o'clock.
Yeah, we can, whatever way is comfortable with you. It's not an, it's okay for me.
Thank you, sir.
Malvika,